Are you stuck on the crossroads on choosing between either becoming a physician assistant or a nurse practitioner? And in this video, I'm going to be going over 5 reasons why you should choose to become a physician assistant over a nurse practitioner. So stay tuned. Welcome back, Psych Dude family. It's good seeing each and every one of you guys today. If you are new to my channel, let me formally introduce myself. I'm the Psych Dude. I'm a board certified psychiatric mental health nurse practitioner, and in this channel I go over several different subjects to educate the public about mental health, ways to improve your lifestyle, topics related to nursing, nurse practitioners, and psychiatric nurse practitioners like myself. So if you're interested in any of these topics, please feel free to subscribe. Make sure you give this video a big fat thumbs up and follow me on Instagram at the Psych Dude. So you probably clicked this video because you're either on the fence on wanting to choose between either becoming a physician assistant or a nurse practitioner. Maybe you're already a nurse and wanting to figure out if you want to become a nurse practitioner or a physician assistant. Or maybe you're right before nursing school and trying to determine whether or not which route you want to go to, or you're just starting off and figuring out different little things that you want to be and figuring out if this career choice is for you. And honestly, you came to the right video. And in this video, I'm going to be going over 5 reasons why I feel that you should become a physician assistant over NP. So let's get started. So the very first reason why you should choose to be a PA over NP is you focus on the medical model, which is the model that physicians focus on. So when they treat patients, they diagnose, assess, and treat patients, which is very, very, very similar to doctors. While as nurses, you focus on the nursing model. And yes, you do diagnose, yes, you're able to assess, and yes, you're able to treat, but they focus more on the psychosocial part when you are a nurse and you're focusing on that nursing model. But as opposed to the medical model where they purely focus on the disease process and treating that as opposed to doing the preventative measures. Yes, a lot of companies are focusing on that, but at a purely medical standpoint, they're treating the disease process at hand. So if you feel like you want to learn more of that medical model, then it just makes sense to go the physician assistant route as opposed to the nurse practitioner route where you do their nursing model and you focus on everything. The second reason why you should choose to be a PA over NP is the fact that PAs get more clinical hours compared to NPs. Let's just talk about the hours that are purely within the NP versus the PA hours. If you're looking at those hours, PAs get way more hours compared to NPs. Yes, NPs get RN hours and all that jazz, but for the most part, PAs get a lot of hours. So if you're on the fence and not necessarily knowing what to do and you feel like you want to get all the hours as possible, then it might make sense just to go the PA route because you get so many different hours and in so many different specialties that some nurses don't even get the chance to do it. And as a PA, you get to be able to do all of those things and get exposed to doing all of those things. And I feel like on the other hand of it is you are getting better experience because you're thinking as a provider as opposed to NP. Yes, you think of as a provider within that 500 plus hours, but you're not necessarily thinking as a provider when you're going through the nursing hours. So it's one of those things, if you feel like you want to get way more hours, way more clinical hands-on hours and training, then it might make sense to go the PA route. The third reason why you should choose to become a PA over NP is you're more generalized. Meaning, it's not a bad thing when they say they're generalized, but meaning you get to do so much. You're trained in so many different things as opposed to just NPs where a lot of the times you have to focus on a specialty. For example, my specialty is psych, and there's ped specialty, there's acute care specialty, yes, there's family nurse practitioner specialty, which focuses on the family, but as a PA, you're super generalized to the point where you're able to jump from one career or one specialty to another, and you don't have to get recertified. And that's the beauty of it. If you're always on the fence on what you want to do, or if you get bored with jobs easily, you could always jump from one area to another, meaning you can go from surgery to emergency room to urgent care to primary care, ortho. You can go to so many different things and you don't have to recertify. For myself, if I want to do acute care, I have to go back to school to get a recertification in acute care, or if I want to do ER, I have to go F&P route and then the ER route, or the acute care route and then the ER route. So it's one of those things where if you find yourself loving to jump from one career to another and you can't decide which specialty you want to go into, it might make sense just to go the PA route, because at the end of the day, if as an RN we got to do anything, we got to go to different units and we didn't have to necessarily specialize. So it kind of makes sense if you want to do that as a PA, you can just go anywhere you want to. You would think that they would have a generalized one for NPs where they can kind of go everywhere. Yes, it's F&P, but it's still kind of frowned upon working in so many different other units like psych or acute care if you're an F&P, but who knows? It's not me. But for the most part, if you feel like you kind of want to get experience everywhere and you love jumping from job to job or specialty to specialty, then PA route might be the right one for you, instead of wasting time in getting recertified, going back to school, recertified as an NP. So think about that. So the fourth reason why you should choose to be a PA over NP is you only have to recertify every 10 years as a PA, as opposed to nurse practitioners that have to recertify every 5 years. And I think it's somewhere around like PAs need only 100 hours of CME credits, while NPs need 75 for that 5 years, something like that. But for the most part, the main point I want to drive is you only have to recertify every 10 years as opposed to 5 years as an NP, meaning less money, less training technically, and you don't have to take a test or have to put in the paperwork to do it all over again. I'm not sure how it is with PAs, but for the most part, every 10 years, that's not bad at all compared to our 5 years. So it's something you should think about, especially when it comes to possibly taking tests. I know that it used to be shorter for PAs that they had to recertify, but they just lengthened it. I don't know how recent, but they went to 10 years, and that's a huge plus, especially when you don't feel like doing all those CMEs and doing all of those things. But for the most part, both sides are constantly learning. They're constantly taking in information, going to seminars, going to different conferences. So it doesn't necessarily mean anything in that standpoint, but having to recertify every 10 years, not bad at all. I'll take it. So the fifth and final reason why you should choose to be a PA over NP is less schooling when it comes to healthcare. Meaning you're going to school way less focusing on healthcare compared to NPs. So as an NP, you have to do either your ADN, your BSN, or your entry-level masters. So that's focusing already on healthcare. So that's a minimum of 2, 3, 4 years. And then you have to do more healthcare schools where you have to get your NP, and that's a minimum of 2 to 3 years again, as opposed to a PA where you can just do your normal classes. You can get a bachelor's in whatever you want. You just have to get the prereqs to get you into the PA program. And once you're in the PA program, all you're looking at is 2 to 3 years of school that's dealing with healthcare. Yes, we're in it for the long run as a healthcare professional, but sometimes people don't just purely want to focus on healthcare. They want to have some other hobby. They want to get a business degree. They want to get a sociology degree. They want to get something else and then go into healthcare and get just a degree. So you have way less school compared to NPs where they have to focus on nursing for a majority of the time, dealing with healthcare from the ADN route, the BSN route, the MSN route, and possibly the DNP route. So there's so much more schooling when it comes to healthcare wise as an NP compared to a PA. So it's something to think about if you feel like you have other interests besides healthcare and you want to be able to expand upon it, like the business side, the sociology side, the liberal arts side, things like that, then it might make sense just to go that route, so you're kind of diverse in that sense as opposed to purely nursing like NPs. Yes, you can get your entry-level master's and you can get a different bachelor's degree, but for the most part, a lot of people typically go the route with just nursing, just so they can have that nursing degree. So it's totally up to you on that sense. But for the most part, both of them are very good careers. It just seems like in this instance, if you want to focus on the medical model, if you feel like you want more experience, if you feel like you want less healthcare schooling, if you feel like you kind of want to go from a career that you can jump from specialty to specialty and you don't worry about having to recertify, then it might make sense for you to go the PA route. Honestly, you have to make that decision for yourself, but there's so many good benefits about being a PA over NP and vice versa. There's so many good benefits of being an NP over a PA, but at the end of the day, you guys have to determine what's best for you. And in this video, I wanted to shed light on the focus on the positives of being a PA over NP, and these are very, very good reasons. So if you're on the fence, definitely I hope this was helpful in some sense of making your decision a lot easier for you. And if you watch this video like, dang, I don't even care about all of these things, then you might just go the NP route and it's harder in that sense, or not harder, but then it's gonna make a harder decision for you because it still kind of didn't answer a lot of the things for you. But like I said, at the end of the day, it's your decision on what you want to do and what's beneficial for you. And honestly, that medical model seems like an amazing idea, and the fact that you get way more hours as a provider, I would probably go that route, honestly, if I were gonna do it all over again. But who knows? I love what I do and I'm happy that I'm doing what I'm doing. Either way, honestly, either way you go, you're gonna be happy with it because both have their benefits, both have their cons, so you just have to choose for yourself. Alrighty guys, now I'm rambling. I hope you guys enjoyed this video. If you did enjoy this video, make sure you give it a big thumbs up and make sure you follow me on Instagram at the Psych Dude. Have a wonderful day, guys. Bye.